Natasha's got a question. Are polyurethane implants tricky to place because of the Velcro-like texture once they're in? Do they stay where they've been put, or do they drop? You know, you see, this is someone who's done your research. She's done her research. So a lot of people who come to me, oh, actually, the other thing I wanted to say, I will answer that question, but the other thing I wanted to say is that I'm very happy to answer questions from anybody. As you can see, I'm very happy, welcome questions. It doesn't have to be from patients of mine. It doesn't have to be from people who are coming to see me in the clinic. So I have a closed Facebook group for my patients who they can, interact there, but this is for anyone. So in case there was anything that anyone thought that they couldn't ask because they're not a patient or they're not coming to clinic, that's fine, no problem at all. I'm just doing this to talk to people. So yes, question, Natasha. Polyurethane, I've been using polyurethane implants for a while now, and when I first started using them, there was a lot of stuff saying they're really hard to use, they're hard to remove, you've got to be careful to place them, all these things, and that is all true. To be honest with you, that is true. They are quite hard to use, they are more difficult to use. You have got to be careful where you place them, they stay where you place them, they don't really move. So technically it is a little bit more difficult to use polyurethane implants compared to silicone implants, but from a patient point of view, I wouldn't make it something that I would sort of worry about too much, because it doesn't really affect you too much. So when people say they don't move and things, that just means you've got to put them in the right place first time. So that's a surgical thing. We've got to make sure we put it in the right place, and we can actually use it to our advantage. So particularly if you think of a teardrop implant, because one of the risks of teardrop implants is they can rotate. So polyurethane implants are much less likely to rotate. So that's actually a good thing, the fact that it doesn't move. Sometimes people worry when they hear that polyurethane implants don't move. They think that they're just going to stay there and they don't actually move. They're going to be like, oh my God, they just don't, they're like rocks. They move with your breast. So your breasts move just like your breasts move now, and they move. They feel and move the same as your breast. They do feel a bit firmer than silicone implants to start with, particularly if you had silicone implants already. They do feel a bit firmer than silicone implants, but then they soften. They take about a year for them to soften. So yes, they are a bit more difficult to place, but I wouldn't make that a reason for you not to have them, because it just means the surgeon has to make sure they get it right and they placing it in the right place. Once they're in, do they stay where they've been put, or do they drop? I make a point of this in clinic when I see people, of showing them photos of polyurethane implants before and after and silicone implants before and after, because they are different. And a lot of people go away and they'll Google it and they'll say polyurethane implants don't move. And so they'll have the surgery and the breast will be like that, and they think, oh my God, they don't move. I'm doomed. They don't move in the same way that silicone implants move. Silicone implants start high and drop. Polyurethane implants start swollen and then settle. It's a bit more subtle with polyurethane implants compared to silicone implants, but they do change. They do start quite swollen and settle. It's just a softer settling than a silicone implants where they actually drop. So yeah, polyurethane implants are a bit more difficult to place. They're a bit more difficult to move. Here we go. As if by magic, Helen's in with what I was just talking about. Helen, cue Helen. Can polyurethane implants be removed after a year and replaced with smooth implants if you wanted to or not? Yes, they could. They are more difficult to remove. Polyurethane implants are more difficult to remove. So after a year, it would be a bit more difficult to remove it than a silicone implant. But that doesn't mean it's impossible. So it is definitely possible, and it is fine to remove them, but it's just a bit more difficult. It's just the fact that silicone implants are really easy to remove. And they could certainly be removed and replaced with any sort of implants you wanted. And if you wanted smooth implants, that would be perfectly fine. So yeah, it can be done, but it's more difficult than silicone implants. But if you've already got polyurethane implants in, what choice have you got? They certainly can be removed. But I normally say to people, I wouldn't make that a deal breaker in having them, because you're unlikely to have them removed. Although reading between the lines, Helen, I'm thinking you got them and want them removed, is it? Because you're saying, can they be removed after a year? You're welcome. So it is unusual to need them removed, but if you did have to have them removed, it would be a little bit more difficult.